Welcome to the Longevity Optimization Podcast, where we discuss longevity, optimal health, nutrition, peak performance, cognitive excellence, and so much more. All right, Dr. Roider, it is such a pleasure to have you here with me today.
Thank you for having me. It's a pleasure.
I've been loving getting to know you. We just met at the conference yesterday, and it's been so fun talking about longevity with you.
I agree. It's a wonderful conference, and every year there are new people coming in, and so you were one of the new ones, and I'm very excited meeting you.
I know, and we had a bonding moment yesterday because we both wore the wrong shoes to the hike, the lunge hike.
Indeed, we had these not insignificant high heels hiking along our way, so no, it was lovely.
Yes, absolutely. And we picked the same desserts, and we had kind of the same menu. So, I think
here we're sitting together.
I know.
Here we are.
I love it. I love it. So, obviously, we're going to be talking about longevity today. Talk a little bit about your work, because you have an interesting background. You're a medical doctor and a scientist, and now you're working on investments in the space. Tell me a little bit about that.
You know, when you tell stories from now on, it all seems to make sense, but there were also times in my life where it wasn't clear, and if it wasn't sure if all this makes sense what I'm doing. So by training, I'm an MD, a medical doctor, originally from Munich in Germany. After graduating, I went into residency in dermatology because I thought it's a very broad topic, from preventative medicine to oncology treatments, kids, adults. So I really like this very broad aspect. I always loved research, so I started my scientific career very early on, originally coming from cancer research, first sarcoma, then melanoma. And via this cancer research, I went to Harvard, where I did the majority of my research, postdoc, PhD later, basically really understanding the cell biology mechanisms of redox biology, different trigger events of cancer. And as you might know, cancer on the mechanistic biological side is very close to longevity, because the definition of an immortal cell is a cancer cell. So I was already very much in that field. Moved down to Switzerland in 2016, had a classic career as a physician scientist, seeing patients, having academic grants, students, teaching. And there basically I realized I want to really bring what I'm doing to the masses. I had different patents. I was intrigued by friends who were in VC, did startups, and I'm like, that's so cool. I mean, it's not you like this one-to-one. It's very rewarding having a patient and helping this individual getting better, but really to have like bigger solutions that can help so many. And so I did an MBA, what an academic does,
Goodness, I just love it.
And via that way, I have met the founders of Maximon, what is a venture studio company builder in the space of longevity. So basically, since then, I'm officially in the longevity space. I've been doing a lot of longevity things like primary, secondary prevention before, research in the space of aging, of redox biology, but kind of this term as a longevity, as you might know, it's also rather new, right? It's finding itself. So basically, since a bit more than 2 years, I'm now officially part of Maximon, where I'm a partner, the chief scientific and medical officer. And here what I'm doing is looking at this in a very holistic way. In contrast to other VC firms, we do not only do biotech, actually it's almost excluding biotech, it's really about consumer health applications. So this can be a supplement company. This is, for example, a diagnostics platform company where you can combine wearables with genetic, epigenetic tests, clinics like the first more or less democratized longevity clinics in Switzerland, a female health company, senior co-living concepts. So as you can see, very broad. And with that, I always try to bridge between medicine, science, and business, basically really bring out very tangible solutions to the people.
Well, I'm so impressed. Just thank you to lay that out there. And that's so interesting. One thing before we dive into like longevity as a whole, I don't know much about these senior living facilities, but I mean, if it's anything like what's in my mind about it, is it like incorporating longevity and senior living? Okay, this is so needed because it's so sad. So many people have, I think on a slide earlier today, 30 years, they're saying. I was hoping it was more like 10 poor years, but a long time in later life that you are feeling not well, and unfortunately sometimes you have to go into these facilities, but this one sounds amazing. Tell me about it.
Yeah, so basically maybe let's take one step back and then go speak about the facility. So when I started, longevity was a bit a wide range between we will live forever to you take this one single pill and then you will be cured from everything, and then others who are saying, oh, it's just about biological clocks. So really, it was not defined, and also then people were speaking about CRISPR and stem cell, and everything was mixed together, and I was like, well, we need to structure that in a specific way. So for a paper, which will hopefully come out, but this is basically just a summary of the work I and my team did over the last years to basically put this in a pyramid setting and to say, what is actually the basis of what we're talking about? Mm-hmm. And basically then the model, now we're becoming almost a bit theoretical, is like we say, okay, we start with the diagnostics. We need to understand what's happening on the mental health side, on the biological health side. From there on, we need to work on physical health, food, nutrition, physical health, and of course mental health. Like here we come into this co-living in a second. And then we speak about supplements, we speak about off-label use, and then we speak about biotechnology innovation. So basically you have this in a bit of a staggered process that really it's clear. If we just do one gene, maybe we do something. But if we do wrong on all the bottom, you will not really flip the coin. Mm-hmm. And so from this pretty broad and holistic view, also this kind of thinking about what do we do with the seniors who are very sad and lonely often, how can we bring them together? So basically having a concept there that mental health is really provided, encouraged, prevented, and so on in living communities, not for really old people, like that they're 80 plus and are disabled and need help. It's more for fit and active seniors to keep them in that status as long as possible.
Yeah, I mean, we know that social isolation has been shown, and feeling lonely has been equated to that of the risk of smoking, right?
Yeah. So. And that's often what we totally oversee, is that this mental health, this social well-being, this being embedded into a community, it's extremely important. Funny data, I was stumbling over the data that people who are a member of a church, I think in that sense it was about the Catholic Church, they outperform almost every longevity supplement. I was like, wow, that's impressive. Yeah, so it's probably this belonging to a group, having a purpose, having really something to live for that helps the people to move and to be engaged and then also to remain fit.
I agree. If you've listened to my podcast for a while, you know that I'm all about changing the way that we age. Well, the founders of today's sponsor, and to be honest, my only sponsor in over the last year and a half, because I love them so much, is OneSkin. OneSkin founders have discovered a way to target cellular senescence. We've talked a lot about that on the podcast, but this is cellular senescence in the skin, which is a central driver to aging. OS1 peptide, which is the first peptide to zero in on cellular aging and deactivate the inflammatory response that contributes to further decline. A lot of skincare products claim to be anti-aging, but only provide temporary surface-level solutions. OneSkin's all-woman team of longevity scientists are dedicated to reversing skin aging on the cellular level. Their line of products, which they call topical supplements, actually interrupt the aging process, pinpointing the senescent cells that contribute to lines and wrinkles and thinning or sagging skin. Try OneSkin's daily moisturizer, sunscreen, and cleanser for yourself using code Kayla at oneskin.co and get 15% off your first purchase. That's 15% off at oneskin.co with code Kayla. I feel as if that might be a big part of why people in the blue zones also have such extended life, because it's interesting, I mean, I'm not sure what your take on alcohol is, but I have it very, very rarely, if ever. But everyone always cites the blue zones, right, when it's related to alcohol. And I'm like, okay, but you can't compare yourself to those in the blue zones because they're living a totally different life. You can't, abstract one small piece of it, which is drinking alcohol, and then apply it to your normal life when they're outside a lot and walking and in community. So when they are drinking, it seems as if they're having it with friends in community. Yeah.
Yeah, I think in general that's a bit the problem with the longevity field, or maybe in general when you search for something, you want to find simple solutions, and then you pick out one and you kind of do your correlation analysis and say, okay, fine, here we have that, and if you do that, everything will be good. And the point is, it's a super multifactorial model, this aging, right? Mm-hmm. You have these hallmarks of aging. These hallmarks of aging drive specific phenotypes. If it's sarcopenia, so not so strong muscles or bone problems or cognitive ability, and so on. And then if all of this summers up, you have the aged phenotype. So that's just what you see. Yeah? And so I think also that's because it's so multimodal with so many networks. As you say, I mean, you will over a big population, if you take out the alcohol, I'm sure it will benefit, no doubt about that. Mm-hmm. But if it's then embedded in another context, it can be interpreted totally different.
Yeah.
So that's why it's unfortunately complex.
It is quite complex. I mean, there's so much that we still don't even know about the body, right?
Yeah, but that keeps my job
Yeah.
relevant, right? Otherwise, I would be hiking somewhere here, I guess.
With all your degrees, I don't think you'll be hiking somewhere here.
Actually, I would love to hike. Let's go.
I know. Let's do that. I love it. Well, speaking broadly about the longevity industry, it's been super exciting. The opening, statement this morning was that it's becoming a lot more mainstream. What have you kind of seen over the years?
I think that's really encouraging because it's considered as a mega trend since a while, but there are also mega trends that disappear. So you cannot be sure that it really remains. But what I also see from my own experience over the last years is that it's huge in news. I mean, you know it yourself, right? You're a bit of a spokesperson there, but also in Europe, it's like, every big newspapers, there are reports on longevity. It's just a question what way will it come? Then the question, if we speak about how will it come, that's what I think is very encouraging. At the beginning, it was like really these uber rich people who said we will live longer, forever, whatever. But this was a big marketing gig. But what I really see, I mean, that's hard data. We also had a talk about that today, is the population pyramid, that we just have a huge fraction of people over 65. And this is a huge problem for pensions, for healthcare systems, and so on. And so the moment I'm speaking with the 4 biggest healthcare insurance providers of Switzerland, who are interested in the programs, like the diagnostic program we are offering and the clinical application of what it really means for them. So I think this says or tells us that longevity will come via the masses now, because I mean, it will not be that everybody's running a 2 million program of different longevity interventions. But for example, I can be wrong, but gut feeling is that whatever sugar, for example, will be taxed as smoking or alcohol will be, so that's taken away. Then you have incentives from healthcare providers that if you move more, if you do this and that, if you do these preventative classes, that you whatever get done some deduction a bit in that way, that there are disciplines. That's actually coming to the next point. What we see is that academic institutions are taking up the topic, right? I mean, at the moment, longevity, and that's actually very important to know for the people who listen now, longevity is not a medical discipline like hematology, dermatology, or surgery. It's something that's in the air, and people from all kind of disciplines cover it, but there's no standardized curriculum. There's no society of, there's a society of longevity medicine, but there's not a board certification for whatever longevity medicine. So I think this is coming slowly. The Healthy Longevity Medicine Society has been starting on that. Protocols are being developed, but this takes time. And so I think with all of this together, I really see this now becoming much more robust. And the good thing is, once it's much more robust, it will allow also investors to have more security in what they're investing in, because that's what everybody's afraid of, that it's discovered as a huge fluff, and then of course you lose quite some money. So I think with more standardization, more investments will follow, and then with that also it will even go quicker, the implementation into the daily routine.
Yeah, that's a really great point. I got asked a question yesterday when I was doing this filming for this Swiss television program. And I let them know it was not my area of expertise, but they asked me what economic impact did I think that people, if we are able to live longer, what economic impact would that have? What do you think?
I think that's actually a very important question, and I even did a scientific study on that. There's one or two other scientific studies on that as well. So basically it goes in the field of health economics. So in short, I think you need to distinguish between living longer or living healthy longer, or living healthier in general. So living longer itself without health will obviously cause costs. I think that's out of discussion. But if we speak about what is the amount of money we save by doing primary preventative medicine, that's very hard. So what I did, I'm happy to send you the paper later, where I used, during COVID, we were not able to do preventative medicine. So like, for example, as I'm a dermatologist, we're doing skin cancer screening. So for an average in Europe, we were in 3 months, we're not allowed to do skin cancer screening. So what this means, everybody's discovered 3 months later. So if you're in whatever melanoma stage 1, you move to stage 2, stage 3, or if you're not discovered, it will be discovered accordingly later. So basically, we calculate a number of people that move up in their stage, and every stage, the more advanced it is, the more cost it has. And so basically, we came up with a economic number of how many people this is, and this can be calculated in direct treatment cost, like how much is this cancer actually if you treat it, and even more important, the indirect cost. So if you or I don't work, that's about 20 times more the cost than what actually the treatment of our cancer is. And that's, I think, a big problem that people in the health economic system do not take so serious. They are often speaking about the direct treatment cost. Instead, like this loss of workability, which can last for a very long time, and is the real cost driver for economies. And so if you take that into account, we saw that the number was incredibly high, almost approaching actually the cost what we have during COVID treatment for the whole topic itself.
Wow.
So very, very big numbers. There are proxies for like chronic diseases, some others, which are present. And I think that's really the calculations that the health insurance providers and also the governments have to take. And once that's clear, I think it's a no-brainer that will come.
I love that. It feels like the health insurance companies, though, are a bit behind.
Yeah, it depends a bit how they're incentivized. So Switzerland has a different system than Germany, and that's, again, different from the US. Usually they're very tightly connected to the governments, and so that also makes them not so agile. I think in the private healthcare, usually they have a governmental part and the private part. In the private part, they're actually, from my experience, they're pretty fast and want to move. They understand the value. On the part that needs to be negotiated with the governments, that just takes time. I don't know how long, 1, 2, 3 years, maybe even longer.
Yeah, well, that's a great point, too, because I'm not super familiar with the system here, but, in the U.S., we know it's currently quite so a sick care system, I would say.
Yeah, because that's also where it's coming from, right? I mean, if we think about, I'm not sure if the number is correct, I heard it once, so if we speak of retirement age 65, when that was introduced 100 years ago, about 3% of the population were above 65. Soon we have half of the population being over 65. Huh? Wow. So it's also like we have this huge shift where simply the regulations did not follow the demographics. I mean, we can foresee what will happen, but still people I think people want to feel it until they really change something. And actually, to step back, why this primary prevention is not so acute, to follow on that. So if you have the majority of people under 65, they're not so suffering from these chronic diseases. Yes, of course, you haven't, but at a very different frequency. So it was simply not as prevalent as it is today. And so with that shift now, with this extension in longevity, what we achieved, I mean, the lifespan dramatically increased over the last 100 years, but the health span did not follow that. And so that's where we have this big bulk of chronic diseases sitting. Because the direct treatments, like treating any kind of fractures or infectious diseases, all of this was done very well, but the chronic diseases, they remained.
Yeah, I mean, in the U.S., chronic disease is just skyrocketing, unfortunately. I think it's like 70% or something of the population has at least one chronic disease, adult population. And that's now starting to trickle down to children, which is like very concerning, but that's...
I see quite some changes happening in the obesity field. As you might know, it's the GLP-1 agonists, which I think are very interesting, not only because they treat obesity or help to prevent further obesity, but also from the longevity side, but we can talk about that later. But I think if we're able to manage this obesity pandemic, a lot of the chronic diseases will go away or will be really reduced quite heavily, because arthritis, dementia, cardiovascular problems, all of this is very tightly bound.
Yeah. Well, while we're on the topic of GLP-1s, we've been kind of seeing in the news a lot of other potential benefits. Do you see any of those clinically, or what are your thoughts?
Yeah, I mean, we don't have hard data on it yet, right? I mean, one side is, as what I mentioned before, GLP-1 agonists, if you resist for weight reduction, if you're somewhat obese, I think there's no doubt that all the chronic diseases that follow that will also be better. The other side is like GLP-1s as treatments in the longevity space. If we speak about rapamycin, metformin, I think also GLP-1 agonists should be added. And here, I mean, if you look at the pathways, they're very similar to what we're talking in the whole metabolic route, right? So in my opinion, it makes total sense that this does play a role on the longevity space and on the longevity problems. And here also, I mean, we see it now with the endpoints they're looking at. A majority of that are age-related disorders. So I'm very curious to see what's happening, but I think over the next 1 to 2 years, it will be very interesting. I think there's even one trial on ovary, age, and GLP-1 agonist, if I remember correctly. I need to double check, but I'm pretty sure. I think there are like 30 plus trials running.
Yeah, I think I saw that too. I think there's a few interesting ovarian aging studies ongoing right now, which is exciting, right? I mean, we know that women are waiting longer to have children, and I'm just excited to see what happens with that. Can you talk a little bit about, I suppose, the mechanism? So you're saying the GLP-1s, let's say you're not obese and you just wanted to do maybe like microdosing or something. We, of course, not talking about dosages, but what is happening there with the GLP-1 agonists? And
I mean, it's really, as I said, with the dosing, I do not want to go out of that in that route. In general, the dose makes the drugs and also the side effect profiles. So I think the lower you dose something, the better your risk-benefit profile will be with a specific cutoff at some point. I think it's hard to nail it down to single pathway nodes. But in a nutshell, it's a bit similar to what's happening with metformin when you have kind of this starvation signaling suddenly starting, where then have these regenerative processes being started. So I do not want to go so far that I really say, okay, this pathway, that pathway might be the trigger ones. But if you do an overlay of the different pathways, then basically it seems to be quite heavily involved in many angles.
Well, that's so exciting. I mean, it's a peptide, right? I mean, we have done peptides, well, we did before the FDA decided to pull them. But, we saw a lot of really great benefits with a lot of different peptides, from PPC and recovery and regeneration, and CJC helping people put on a little bit of muscle mass. There's a little bit of body fat. So I'm excited. Well, I'm interested to see what happens with that. So now they're like not in compounding pharmacies. I'm excited to see if we bring them mainstream or what. But I think there's some pretty powerful exogenous molecules out there that can benefit longevity, bone, muscle, all the things, that we know cause aging.
I agree.
All right, so let's talk about some practical. Now we're going to tap into your medical doctor side. Let's talk about some practical things. Like, what are you doing to, improve your longevity?
In general, I'm a bit reluctant to kind of say, do this, this, and this, and then you will live forever or as long as possible. Yes. Well, the reason is that as a doctor, I feel that I have special responsibility to make sure that the clinical trials are in place to back that. But maybe to speak in very simple terms and a bit more generalistic, so people can orientate on it, and from there they can see their specific, if it's a general doctor, a longevity doctor, I think it's important that they have someone who they trust with this topic. In general, classics are food and exercise. Food, I think we have a bit of an overload of carb, or in some areas a quite significant overload of carbs, which is very close to the sugars, right? Rice, pasta, potatoes, and all of this. I'm not saying take it out completely, like the hard keto diet, but a bit on the more lean side. I think that's something where majority can benefit of. On the exercise, here also we have quite good guidelines in place, but I think if people try to exercise maybe 3 times per week with a mix of endurance and especially muscle mass, I think that's something that's really important, because muscle mass is so important also for your longevity, for your aging. Also then if we speak about the medical intervention, that like GLP-1s, I think here that's actually important to come in. Supplements, for sure, personalized. Here we have a huge variety. Unfortunately, it's often not personalized, often because the guidelines are unclear. It's even the ranges are not clear.
And sometimes the ranges aren't even what's in the bottle. So you should obviously get third-party lab tested, all the things.
So I think that's tough. We have one company, Avea, I think they have nice bundles in place, but even that, I think it's always good to check. There are quite a few supplements that are backed a bit better. Now we have from this year, for example, spermidine, which seems, especially if you combine it with exercise, to be very efficient. Let's see. There's more and more coming out. As you know, the supplement market is as unregulated as the cosmetic market because it's supposed to do no harm. I'm a bit reluctant with that. I think if you do really too many, you can do harm. Also, you can overdose that. So be a bit careful. I can recommend that you follow the Avea company we have. There are other very good supplement companies as well, but kind of have something. Don't overdo it. And
what do you think is overdoing it? Like 10 pills, 20?
If you really have an issue, right? Then it can be more. But I think once you exceed like the 10 pills, it's getting a bit tricky, but this is a number I throw in the room arbitrary. I know you take more. You have vitamin D and you have iron just as the baseline, and then you have, I mean, something I actually would like to explicitly also discuss is like this NAD pathway, the metabolism pathway. It's very much hyped in the media because there are also influencers talking about it. And I think here also, if you are prone to cancer, be aware of whatever you're doing in the longevity space, no matter if you're speaking of off-label drugs or supplements, really double check, because everything you're doing is giving energy to your body. So if you have anything, you had a cancer, you're prone to cancer, really be careful and double check that, and maybe do not do like the super high potent things, just as a side note.
No, that's a great...
and then if we speak about drugs, I think off-label drugs here, in my opinion, it's a mix out of anti-inflammatory agents. I mean, rapamycin is here a very classic one, at a very low dose for sure, but again, it's off-label. Aspirin has also good benefits, for multiple reasons, not only on the inflammatory side, obviously also on the blood clotting, other prevention side with P4. And then you have this metabolic arm. I think so far there was metformin, now we have the GLP-1 agonists that are coming in. And here I think it needs to also be a bit tailored to gender, age, but especially age. I think here it plays a role. Like, for example, my feeling is metformin is a bit better for the elderly population. Maybe the GLP-1's a bit for the younger, a bit more obese ones. So I think here's some medical lead needed, but anyway you need it because it's prescriptive drugs. And then, I mean, other things is kind of this hormesis concept, right? That you have small stressors in your life, like heat, cold, obviously, like even if you don't have a cryo, you can shower cold, you can go to the sauna, like all these kind of things. The contrast therapy, like oxygen stress signals, I'm sure you spoke about that so much already, IHT, hyperbaric oxygen. In the end, it's always like giving a little push to your body, then taking it away and give some time to recover. I think this is a bit the bread and butter longevity routine that I would say most can benefit of. But again, I think I really hope that now with the emerging market of the longevity clinics, that there's a bit more guidance. I was just talking to 2 other doctors who also have clinics in London. We exchanged the protocols. We're like, okay, finally, it seems like we're doing more or less the same thing. But you see, that's still where we are. So different doctors do different things. It's not so much standardized. And my guess is in the next 5 years, we will have much clearer guidelines of what to do.
And of that, what are some of your favorite labs to run, and what are you looking for?
Labs, you mean like a blood work laboratory?
Like blood work or toxin testing, gut health testing. What are some of your favorites?
Well, medically, the most established is vitamin D. I mean, that's very obvious. Then consumer-wise, I mean...
Or even for yourself, like what are you testing on yourself?
Well, iron, vitamin D, I think that's really like the baseline.
Okay,
we have
not that boring. I know.
We have with Ayun a pretty comprehensive panel in place. We're happy to also introduce you as the lady to go in all of these details. I mean, we have it there. We're also doing our own measurements tests to see how well is that reflecting, and then also the offerings we have, like if we have like IHT, HBO and so on, how much is it really reversed, I mean, this is also something, what is really the therapeutic consequence of the blood works we do. And that's actually, by the way, that's also why I'm a bit reluctant in discussing that further, is that the longevity field is criticized heavily from the classic medicine field for overdiagnosing and for doing things just to be active, testing things without knowing what the real consequence is. And here, I think that's something where we need to be a bit careful. What I still think is also, I mean, here we're also coming in the gray field, but like if we are to speak about genetic risk profiling, ApoE4, for example, like this dementia, I mean, I'm sure you discovered that. That's also something not to tell people, oh, that's what's going to happen to you. It's not the case, but maybe you can change your lifestyle, your behavior in a specific way. So I think this is something where everybody should go through and where everybody can benefit from. And then, of course, we have this big clock discussion that I was just going to say about the consumer market. I think this is something that's interesting because it's an additional test asset that you can provide and kind of hook where people come in. But here again, I mean, we know now that it's a proxy, but it's important to have then different insights, different clocks and so on to really combine that.
Yeah, I agree with that. Well, I would go through all the tests I do, but we don't have like about 3 hours.
I'm sure you're doing everything.
All the things.
You better should.
All the time. Well, this has been such a pleasure to chat with you.
Same.
Thank you so much for coming on.
Well, lovely talking with you. I'm sure we'll continue.
I know. You have to come visit in LA soon.
Will do.
This podcast is for informational purposes only, and views expressed on this podcast are not medical advice. This podcast, including Kayla Barnes, does not accept responsibility for any possible adverse effects from the use of the information contained herein. Opinions of their guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein. If you think you have a medical issue, consult a licensed physician.